Universal Health Coverage Day. The day comes as the rollout and implementation of the National Health Insurance, which is aimed at ensuring access to health for all, remains high on the agenda in South Africa. Now, a panel discussion on universal health coverage and the National Health Insurance Scheme is currently underway at our SAfm studios with the host Bongi Gwala of Talking Point. It's, as we've been saying, radio meets television this time round. Let's take you back there live.
To start off with the question of those who say we must fix what is wrong now, we actually agree about fixing. What we are saying is that you can't do one and leave the other. We have to actually bind the two together and say that the basis on which we are fixing the health services is to be able to create a platform for a national health insurance. So whilst we're putting up a legislation on the one side, we're going to be doing the fixing of the issues on the other side.
Okay, so Minister, just pause right there. You will continue. Let me quickly welcome the SABC News Channel 404 viewers as they join us in this discussion. We are talking about the universal health coverage, and of course we've got a number of guests here who are with us to try and understand this animal called the National Health Insurance. The process is, where is the process right now? What does it mean for South Africans? What does it mean for private healthcare? What does it mean for medical aid? What does it mean for the 86% of ordinary South Africans who do not have medical aids? That's what we're trying to understand and unpack here today on the 12th of December, this being the Universal Health Coverage Day. So thank you very much for joining us. The Minister of Health is Dr. Kize, as he's responding to the questions that have been raised by the audience here. This is SAfm 104 to 107. Appreciate your company. So please continue, Minister.
Thank you very much. So I think we need to start by accepting that there are lots of things that are wrong with the public health service that need to be fixed. We've raised the issue of staffing, the issue of the supply of medicine. We've raised the issue of the management, the issues of corruption. We've raised the issue of infrastructure. We've raised the issue of the reorganization of the services so that there's a strong emphasis on primary health care, preventative, palliative care, rehabilitation, and all of that. So that is important. I think we need to accept that you can only fix this system if you have a clear direction as to where it needs to be. So the NHI is our standard that we want to move towards, and therefore we're going to do the fixing. But we are saying whilst we do so, we create a framework on the one side that will create this fund and therefore begin to create the mechanisms for running an alternative system. And so it's a whole process of fundamental transformation of the health system. So the old is what we have, the future is NHI, and we want to say, we want to put a flag of NHI, and as we start the process of implementing, we're converting the system to that kind of level, changing the level, the structure of management, as I said, delegations, and fixing all the issues. The AG is talking about issues of corruption, misspending, underspending, overspending, irregular spending. All of those things need to be eliminated.
They've been with us for the longest time, Minister. How will they change now when we introduce NHI? What will change?
I think the first issue, as I say, when we're saying we're transforming, we're basically correcting whatever was wrong and bringing it to what it should be. And so it's a commitment that we have to make that this has to change. And we've already started that process. When I say that the President has put up this Health Sector Anti-Corruption Forum, it basically begins to say there must be more attention paid to the issues of corruption. We are sending people out to go and train to understand how the management of hospitals, the management of the system under NHI has to be done, because we want people to be having access to a different vision of what you can do with the health services, and not sit here like everybody here, be pessimistic to say, well, it's been like that, it's always going to be like that. And we're saying, no, you must not accept the fact that the system that has deteriorated is our standard. Our standard is something better than that, and so we're actually determined to go through that. We actually started a program of training people on quality of care. That whole program is about ensuring, simple things, cleanliness, issues of attitude of staff, issues of ensuring that the food is good, that there's a feedback from the public on all of that. So these issues have to be dealt with, and we're committing to deal with those, and those are our focus for the next 5 years. We're saying that those are the things that we're going to deal with. We deal with it at the same time as we set up the mechanism for managing the national health insurance.
Why centralize it, Minister, if I may ask?
Well, you'll have to decide whether I must answer all these questions or must leave them and come into this one. But let's deal with the issue of centralizing which you are raising. This is one health service. Let's not deal with it as though we're talking about different countries. It's one health service, and therefore when we say that the legislation must deal with the minister has to, at the end of the day, for the health services, the minister has to take responsibility. How the minister devolves the powers, how the minister shares the powers, how the provincial departments enact some of the legislation to complement and to define their roles is an in-house issue. So there's nothing that is different. We are running one country system, and it's got to be seen on the basis that provincial leaders, heads of department, and MECs and the national minister are all one team that's running the entire system. So it's not just one person running the show, it's a whole team that's running the show. So when we say some of the things are going to be done by minister, we're basically saying this is an assignment of responsibility, but each one of the issues has to be assigned to the level at which things are going to happen. Now, if you've got some of the legislation that says the minister shall do this, it basically means that if you delegate, you can always intervene where you think that the norms, the standards are not actually being properly followed, and so that's what it's all about. So we're going to create a balance of the relationship between the two. But I think we mustn't make a mistake to think that KwaZulu-Natal or Western Cape is a separate country that must run its own thing. No, it's not such. It's one system, and all of us have to work together, and we have a central kind of authority, so the minister becomes just a representative. So when we talk about centralizing there, I think we're misunderstanding what actually is happening in this thing, and all the departments are supposed to work on that same basis. Right. So having said so, I think the next question, therefore, it raises the question of the financing. Now, we have not given a money bill here. This is a bill that is about the framework of a health service restructuring. And therefore, it gives you a sense as to where the sources of funds should come from. And we talk about the fiscals, we talk about contributions from employees and others, dedicated or surcharges where you could be looking at alcohol or could be looking at tobacco and so on. That issue, it gives us a sense as to what possible pools exist for these health services. Right now, when we talk about public-private, the contributions come from private sector, employers and employees, and government. Public medical aids actually have got an element which is a contribution from government as well. So people mustn't think that it's all private money. There's also public.
What's the percentage?
Well, I don't have the percentage, but I believe that it's something along the lines of probably about 20-something billion that comes from government in terms of the tax rebates and so on. So out of what gets contributed into the medical aids. So the issue at the end of the day is that we're saying that's the pool that needs to be managed differently. The reason why that pool has to be managed differently is because the management of the services and the purchasing of the services, the only way of trying to equalize so that people can have access to the services based on their need, not on the basis of who can pay. Now, there was a reference to the health market inquiry. The health market inquiry has come out to say that there are too many things that we've allowed the private sector to get away with, which are challenges. For example, the over-concentration of some of the private beds, which are not determined by the patient needs, but by the financial interests. In other words, you need more beds, but you don't take them to the rural area where you need them. You take them to city centers where people can pay, which is really what has been criticized upon.
But is it not the function of the private sector to do that where there is money? They are driven by market demand, supply and demand.
It takes you back. Health is a right, it's not a commodity. So then what the Judge Ngobo says to us is that the Constitution, by saying that health is a right, is basically saying the government has got the responsibility to provide the health services. Then the government can determine that it can outsource certain aspects of it, which is now to the private sector. When you do so, government has to bring in a lot of legislation to protect the public. Now, as we speak now, the government has been criticized. In fact, some of the panelist organizations have been criticizing government for not overseeing or supervising the private sector, so that there's been overutilization. That basically means overcharging. That means overservicing. that the government has had to that government has to tighten upon. So all of those issues basically mean that to get to sustain a growing private sector provision, you end up having to increase the cost and increase the servicing and sometimes prescribe what is not necessarily needed by the individual simply because it can be affordable within that particular structure. Not necessarily that's what the patients need. Now, those are the imperfections of the system, and we're not criticizing the private sector only on that. You also need to put a sense of where the needs are, where the beds are needed. But when the government tried to do that, the private sector went to court and took the matter to court. Okay. So the issue is that we have to accept that the public sector has to be reformed. The private sector has also got to be regulated, and the issue is how to create a balance between those two. Okay. So as far as I would be therefore concerned in this area, it is not just true that people who pay for medical aids go to the private sector. Most of them who lose their benefits halfway through the year, they end up coming back to the public sector system. And therefore, to think here that the private sector is a perfect system is actually incorrect. Going to the future, the BBC is asking what will be the role of the private sector. We will be going through accreditation of all those who want to participate in the service, and when we do so, private sector can be accredited and therefore can participate in the National Health Insurance program. It's a matter of providing the services and agreeing. Prices have to be fixed and determined. Every country does that, and therefore what the doctors will earn and so on will all be regulated through the pricing. It's a new thing that the doctors can charge anything. In the past, there were certain tariffs that were put in place, and this was actually removed. And we need to actually bring back a mechanism that manages the cost of care. In the countries where national health insurance is being practiced, the pricing committees sit and actually determine that on the basis of the volumes that government can guarantee to the private sector, then a certain amount of pricing has to be determined.
So yeah, quite a lot to cover there, and I'm sure you were covered in those questions you'll ask.
All right, you're watching live visuals there from our SAfm studios talking about basically NHI and health coverage. Remember, NHI is this financing system that is designed to pool funds to provide access to quality, affordable personal health services for all South Africans. That's key. It's for all South Africans, irrespective of their socio-economic status. We'll try to touch base with Bongi Gwala and his team with regards to this panel discussion in conversation with the Health Minister, Dr. Zweli Mkhize. We're going to